Hello and good evening. It's 6 p.m. UK time, so this time to start our online patient meeting. I am glad to be back here and with another representative of EGV clinic located in Latvia. With us tonight is Dr. Solvita Funka. Hi, Dr. Funka.
Hello,
How are you
hello.
feeling?
I'm good. Today is nice, and the last work it's need to be done is to talk with the patients from abroad, and it's nice to do it by the online presentation. Why not?
I am very happy to hear this in such case. And of course, all those events have been brought to you so that you can meet some top fertility experts. And also, you will have a chance to ask your questions. Some of you, or most of you, are still not able to start or continue treatment. So we are still here to support you however we can with those webinars, with those online patient meetings. And all those events also have been brought to you thanks to our ambassadors and partners. So, as always, I want to mention that they are supporting us through the whole 3 months that we are having all those events. And you can see all of the partners and ambassadors right here on the screen as well. And as always, just let me remind how everything works. We will start with a short introduction. We will go for the most common questions from that patients usually ask, of course, on our topic, which is preparing for egg donation. And then it will be time for your questions. You need to just simply put your questions in the chat section, and that way Dr. Funka will be happy to answer them for you. All right, and I guess we can go ahead and start. What do you think, Dr. Funka?
Yeah,
Are you
yes,
ready?
we can. Yeah.
Excellent. Happy to hear that. All right, so go ahead.
My name is Solvita Funka, and I'm from Riga. Nearly 10 years I'm working in assisted reproductive technology clinics. And flying before the virus were a lot of conferences where we were going to find something new which we can take in place and to help our patients. But at the moment everything is going through the computers. Like now we are meeting each other through the computer. In one way it's quite strange, but another way the borders are open till we have electricity. And I guess we can start with the questions.
Excellent. Thank you for that. And let's go for the very first question. So, how to prepare my body and mind for egg donation?
I guess it's very important always to think not just about the technical things which will choose for you, doctor, but it's always very necessary to think about what I'm doing by myself. How can I improve the possibility of becoming a mother? And when we are talking about the body, then that's mean enough of physical activities and the clean eating, no smoking and no drinking. And if we are talking about the mind or a psychological state of myself, as I mentioned before, the woman needs sometimes help from psychiatrist, psychological doctor, or family doctor. Sometimes it could be just friend, but most of the situations it could be chosen a doctor. And to prepare the mind for the procedures which she will have in near future. And that's good idea, not to be afraid to talk with some professionals about my concerns, not just with a gynae, which you will see in any clinic where you will come.
Perfect. Thank you so much for the very first question. Let's get to the next one. So, what kind of tests can my partner perform?
If we are talking about the partners, for the beginning, he need to do at start at least a spermogram, and the spermogram has additional tests as well, like HbA tests, like DNA fragmentation tests, like tests which can help embryological doctors to choose the right way how to work with the sperm, and for assisted reproductive doctor to choose what kind of treatment to do. And then he can do tests for infection diseases like STD diseases, and infection diseases from the blood as well, like hepatitis, like HIV, like syphilis. Those are the tests which need to be done, I guess, all over the world before the treatment of assisted reproductive technologies.
All right, excellent. Thank you so much again for answering this question. And next one is, so fresh or frozen embryos, is there a difference?
At the moment, in the whole world, for freezing embryos are using vitrification. It's very, very fast technique, which is like taking embryo in the state in which he is at the moment. And anyway, if he's fresh embryo or he is like frozen embryo, that means there is no difference. The techniques at the moment is so precisely, and if we're talking about the results, there will be no difference. Is it fresh or is it frozen embryo? And it sometimes is better to choose the frozen embryo for the transfer.
Excellent. Again, thank you so much for that question. Indeed, something that has been asked over and over again. So thank you for clarification. And next question, so is about the selection of the donor, how the matching process is organized.
It's vary from the country to country, because there's countries where law is like donors are open. That means you know who it is and how it looks. For example, in our country, the donor program is closed. That means the patient will know about the donor age, height, weight, the blood type, blood group, what else? I guess it was all the criteria. And for example, if you want some special things in the donors, like somebody is a musician and he wants the donor could be a musician as well, then we know our donors and we can try to match those things as well. But it's not very, like, it's not always possible that all the criteria which patient wants will gain in one exact donor. Otherwise, matching processes in that kind, we need to match your menstrual cycle with the donor menstrual cycle, and that's the matching process as well.
And again, thank you so much for that. And now we will have the last question when it comes to those most common ones, and we will go for your questions. So let me remind everyone, if you have any questions, go ahead and type those in. And the question is, so how can I improve the implantation process?
That will be already in the situation when the doctor already know his patient. He has having talks with the patient. He has seen the patient ultrasound. Maybe the doctor has performed a hysteroscopy or laparoscopy or other kind of investigations to be sure that everything is clear and good. That's mean. For example, we can find a test like endometrium receptivity test, and it will help to know what's the exact date when we need to put the embryo inside the womb. And there's a lot of more little things which we can choose for every patient, like exact during the situation, looking to the patient data.
And excellent. Thank you so much once again for answering all those questions. And well, it is time for our patients' questions. And Dr. Funka, are you ready for this?
Yeah.
Excellent. Let's go. The very first question. It is right here. How can we improve the quality of the endometrium, the microbiota of the endometrium?
If we're talking about the endometrium, then it's a very common thing. If you are from UK, that I guess the ultrasound in UK are doing the technicians. For example, here in Latvia, like in our clinic, all the ultrasounds we're doing performing we like doctors. That's mean we are looking to the endometrium completely differently. And sometimes we can see the polyps. Sometimes we can see the he's like stretch marks inside the endometrium, or sometimes we're seeing like stuff inside the endometrium which needs to be resolved, taken out of there before the procedures, before the embryo transfers. If we're talking about the microbiota, then when we are performing like hysteroscopy, that means we are going inside the womb and looking how it's looking all womb from inside. Then we are taking the sample from there for the microbiota, what's living inside the endometrium. Sometimes there is infection, and that could cause the possibility that there is no result during the embryo transfers. That means before the procedures, we need to know what's going on in your womb. That would be my answer.
Okay, thank you so much for your question, of course, and your answer to that. All right, the next question is here. I'm going to have frozen eggs. I have been given a course of tablets. How long do you need to take them for if you get pregnant? Do you need to take those tablets throughout the pregnancy then?
A second, I will read one more time the question. The question, what kind of tablets? Because there could be a different stuff which you are getting. That would be my additional question to the patient.
Yeah, you could just let us know just to make sure, okay? Clear, then we will be able to answer.
Because it's different answer in situation when it's hot preparate or it's cold preparate. It's quite different. I need to know what exactly.
Let me just show you. Yep, there is additional information. Some are for menopause, which I find weird. Okay.
If it's a progesterone and estrogen, that's not weird. It's a normal thing. That means maybe there are some problems with your endometrium. Maybe it's not growing very well, or maybe it's your cycle is not regular, or maybe it's very different from patient to patient in situation. But in cases of assisted reproductive, that's not weird. That means your doctor is trying to do and to help your endometrium to be ready for the embryo transfer. And aspirin will help to make a better blood supply, and before the embryo transfer and during and after, it will help not to do this clotting in a small capillaries.
All right, thank you in such case for that additional information, and thank you, Dr. Funka, for answering that question. Okay, now let's have a look. We have a longer question, so let me just show you here. What is your view or a donor having a corpus luteum that is filled with some yellow liquid. Would this affect the quality or the number of follicles, or both? She did a preliminary test which showed this. She showed 16 follicles. What do you suggest she should do to get rid of it? Example, should she go on the birth control pill? Any diet change? Example, no white flour, simple carbohydrates, add extra veggies, etc. How quickly can she then do a cycle?
The corpus luteum is a normal thing for any woman every month. That means she did the ultrasound after the ovulation. When she is going to the doctor to do the ultrasound straight after her menstrual cycle, the corpus luteum could maybe already gone from there, and then she can start the cycle. In some cases, we are choosing the birth control pills as well to be sure that there will be no ovulation forwards as well. Yeah.
Okay.
About the diet changes, I could say it's diet is always a very precious thing, and as healthier as better.
Of course. And there was additional, yes, she had just finished cycle. Okay. Thank you so much then for that. Okay, let me have a look. Of course, there are more questions coming up, and here is the next one. I am waiting an MRI for possible adenomyosis. How can this be impacted by my chance of getting pregnant and miscarriage even after a couple of months of taking Lupron?
I will try to find what's the medication because the company names and the exact medication names are quite different sometimes in countries to countries. If we are talking about the adenomyosis, then the question is, do you have a myomas as well, or just adenomyosis? Do you have endometriosis somewhere else as well?
Let's wait. I think, Bethany, if you could let us know as well. Someone is typing, so I just want to wait and check it.
Yeah, okay, understood about the medication. Not sure how endometriosis. The adenomyosis is this actually one kind of the endometriosis as well. That means the endometrium cells are inside your muscular part of the uterus. To help become a pregnant, yes, that medication which you are having could help you to get pregnant, to make better your chances. But there's more additional things which need to be known to say for sure what can more help you.
Okay, thank you for your question. There are like two similar questions actually. Just checking in regards to frozen versus fresh. So first one is, should I choose frozen or fresh donor eggs if I have adenomyosis?
There's no difference.
Okay, understood. And again, this is like, could you go through the reason for and against using fresh or frozen eggs?
Against using fresh, frozen. It's differ again from patient to patient, and it's needs to be known the clinical aspects of you as a patient as well to be sure to answer which case scenario you need to choose. For example, if we are talking about the frozen situation, then it's much more easier. You don't need to wait till the donor will have the cycle, or a doctor will not need to match your cycles. That means you can have the procedure earlier. For example, if you are 47 old, then you, in your case scenario, is as fast as I'm ready, as fast as I'm doing the procedure, as fast as I maybe become pregnant. If you are 25 years old and you have no tubes, and that's the only no tubes, and some additional problems why you don't have your oocytes, then your time is not so very limited. But it depends very much from the addition stuff, what's going on with your blood pressure, or diabetes, or endometrium, or myoma. There's a lot of stuff which could say why one situation or why to choose other one situation.
And there's an additional information here I just showed. Yes, just reason I ask is I have premature ovarian failure. I'm 38, have already 2 biological children.
Yes, if you are and if you don't have any other causes and problems, if we're talking about fresh eggs or frozen eggs, there is as well the question about mm, what is saying your doctor in place where are you coming to, because it depends about for example Spain, they're the biggest place for doctors who are working with the frozen eggs, and the results are good. For example, if you are in some small city or some small country where there is not so good or sorry, lost in translation. So often the embryologist is not so often working with the frozen eggs, then that could differ. But actually, most of the situation at the moment already now with 2020 or 2019, the results will be the same, I would say.
All right, excellent. Thank you so much again for that. Next question is actually what medication are required prior to frozen egg donation?
You mean you like a patient or okay, what medication are
I believe
required
so, yeah, for
for
the recipient, but
again, it could be a bunch of different medications because from patient to patient situation it differs. It could be just estrogens and then progesterones. It could be the gonadotropin releasing hormones to stop your menstrual period for a while and then just then start the estrogens and progesterones. And there could be a bunch of different additional medicines like aspirin or fraxiprine or it's like a heparin preparates. It differs from your clinical situation.
and of course, thank you so much. And I just want to mention to you that if you would like to get some more details, yes, you are also able to simply send your questions and requests uh, to this one. Actually, this is a link, direct link, and that way you are able to get some more medical advice, of course, with all the details in regards to your case. Yes, because of course, and that would be thoroughly checked, I am sure, and the team EGV and Dr. Funka will be happy to help you out as well, right?
I'm seeing that patient is writing about her something. Well,
Yes.
patient waiting for my donor. Sometimes it's necessary. Yes, definitely.
Okay. Thank you for that. And now let me go to the next question. It's right here. So, are there any risks that donor and receiver or the husband are not compatible? What are the tasks to be done to ensure it works? What is the success rate of donor egg cycle for a woman age 37?
In our clinic, again, from clinic to clinic, from patient situation to patient situation, the um, success rate will differ, because it's different regardless the diagnosis which you are having. If we're talking about the our clinic, then it's 56% possibility that you can achieve the success after the first cycle. If we're talking about compatibility, it's the same like you and your husband. You never know it will work or not, and it will depend us from eggs. It will depend from spermatozoa as well, because there's two cells, not just the one cell, which will in the end become an embryo, and then will be you, a carrier of the embryo, will be their pregnancy. And then there's a multiple of stuff which is involved to have a result.
And thank you once more for your answer to that question. And there are plenty more questions coming up, and let's have a look at the next one. I am using an egg donor in Spain. All information is anonymous. I am worried in case the child doesn't look like me, although we are using my husband's sperm. Also, we are having the PGS test done on all 7 embryos. Will this eliminate all genetic conditions and the possibility of miscarriage?
The possibility of miscarriage, no. The possibility of will you become pregnant or no, again, no, because but as I mentioned already before, there's multiple of reasons why maybe you will not get pregnant. It's sometimes it's like that all 7 embryos could be sick, or also even embryos could be healthy, but that doesn't mean you will become pregnant in the end. It's possible, the situation like that. If you are worried about that child doesn't look like you, I don't know how the colleagues in Spain is working. For example, I know how we are working, because in our country the program is anonymous as well. And I, as a doctor, I see you, or coordinator see you. We know how looks our donors. We are trying to match as well your result, your look with the donor look, and you could be sure that if you become pregnant, then the baby will have your DNA as well, because your baby will have your blood, and that means he will get your DNA as well. And till now, I haven't seen such a case where baby is completely different in his life, like from mom. But in a normal situation, there is a lot of families when somebody is like a redhead instead of a dark head, because grandmother was a redhead.
Excellent. Thank you so much for clarification. This is always an important question, but it's true. You never really know when it comes to genetics, right?
Yes,
Perfect.
definitely.
Thank you so much for answering that question. Okay, let's have a look at this question. When choosing a donor, if the donor has medical conditions like allergies to nuts, asthma, should we stay away from these conditions as they could be passed down genetically?
I'm not very sure about the allergy and genetic condition. Maybe I will not answer, but I could say how I think. Um, Nowadays, people live sometimes very clean lifestyle. Like, for example, now when we're having a COVID virus, we're having soaps everywhere, and liquids which are killing a lot of bacteria which are normal for our skin. And sometimes those allergies is related to very clean living. sometimes those allergies could be related with the psychology of exact person or family situation in the house. I'm not sure that choosing donor without the any kind of allergies will mean that your kid will not have any allergies in his life.
Okay, thank you once again for answering that question. Okay, next question is ready as well. Hello, thanks for your time. I'm on hormonal therapy medication. How far ahead should I be off medication prior to IVF with egg donation?
What kind of hormonal therapy?
Yeah, if you could clarify that for us so Dr. Funga can answer it for you. Let's wait a minute. If not, we will simply go back to this question, but I see someone is typing,
Yeah.
so let's give
Yeah.
it a minute. If not, we will simply go back to this question. Please let us know what you exactly mean by that hormonal therapy, okay? Medication. Okay, let's go to the next question and we will continue. All right. So the next question is, what can we patients do at home to improve the microbiota? Any supplements, diet? My clinic is not offering the microbiota test of the endometrium sample. Ultrasounds are not showing any abnormalities or infections.
The question is why you are thinking that your endometrium is having any kind of problems. Yes, that is one. But the second one, if you are eating healthy, if you are not having any infections, then I would say, uh, sorry, I would say there is no problem with your endometrium, or I don't know. The question is why you are thinking that there is a problem with your endometrium.
The patient has added recurrent implantation failures also with egg donation.
Okay. Then the question is, did you had a test for endometrium receptivity or not? If you haven't that test, I would recommend to do it. If there is possible to do it, I'm sure that it is.
Again, I believe the patient is writing, so just let's have a look. And we have a follow-up from the previous
Yeah.
question as well. We will get back to it as well, okay? But let's have a look. I believe that we are having another comment here, so I just want to finish this question that we are having now.
Yes, I think I have answered because I would do the error test.
Error test.
Yes.
Okay. All right. So if you have any additional questions to this one, just go ahead and type it in. We will go to the previous question, and if we need to, we will go back to this one as well. Okay. So it's regarding the question we had. Sorry, let me just go back. It was right here. It's regarding hormone therapy medication. And the follow-up is right. With regards to hormonal therapy, I'm on Fermoston 1 for premature ovarian failure.
You could use it till the moment when your doctor is able to start with your cycle, and that's mean you are using the femistone, and then the doctor is changing those medications for those which he will use before the embryo transfer.
Okay.
You have no need to wait additionally, like without anything.
Perfect. Thank you so much for clarification. Okay, thank you. There is the answer for you. All right. Like here.
Welcome.
Excellent. Thank you so much. And now let's go to the next question. Let me just go to this next one. All right. Can I use doxycycline antibiotic or azithromycin? Sorry, not sure.
Yeah, okay.
For both in case of infection.
if you are doing those medications just before the embryo transfer because you have some infection disease, then I guess yes, because sometimes you need to treat something with something which the medication which could help for you. For example, the doxycycline wouldn't be very good for a man before the IVF cycle.
Okay, excellent. Thank you so much. Next question is right here as well. My donor has 3-4 months until I'm ready to travel to the clinic. What medication, vitamins do you recommend for donors to start taking ahead?
From my opinion, if a woman is eating healthy, not smoking, not drinking, and eating veggies and meat and fish, like the diet is very different things having in daily life, then I would say vitamin D and maybe folic acid. Otherwise, there's no need for additional chemical vitamins because we can have everything from our food.
Oh, of course. Thank you so much once again. And actually, there is a follow-up to the question about ERA test. Yes, you asked whether that was, you had suggested that. Patient has added, yes, I have had ERA, but also once a biopsy during hysteroscopy showed endometrium inflammation, kind of chronic endometritis, and I was given doxycycline for 10 days. It was 4 years ago. The doctors do not see a necessity of checking it again. Once cured, the CE, do you think it does not repeat again?
We never know will it repeat again or not. It could be that you are having some other infection there inside the endometrium. One possibility, the doctor could take just a biopsy from the endometrium and then send it to the microbiology laboratory to see is there any kind of bacteria inside the endometrium. Other possibilities: do the office hysteroscopy and take the biopsy from the endometrium and send it again to the lab and see is there any kind of bacteria. Because if there is no bacteria, there is no need to take again the antibiotics without a reason. Maybe it's cured already 10 years ago.
Okay, thank you once
Sorry,
again.
4 years ago.
4 years ago. Okay, any supplements the patient has asked?
Lactobacterias for women, for flora of women, if you want really something to take from the supplements. But from supplements, everybody needs a vitamin D, definitely.
All right. Thank you once again for that. Excellent. And well, let's have a look at the next question, which is right here. What is the more or less percentage to have twins after 2 embryos transfer from egg donor? I am 38 after 5 IVF with own eggs.
I'm not able to say you some of the numbers because I haven't read it latest. For example, it's quite different to say in every clinic is a bit different of the numbers, and there is possibility that then you could have a twins, but at the same time you could have a twins from one embryo as well. I would say, as always, like 50-50. But most of the situation, there is no twins.
All right. Thank you once again. And I do see that someone wasn't able to be here from the beginning. I just want to remind everyone this is being recorded, of course. Therefore, you will have a chance to rewatch it. It will be available on our website within the next few days. And well, let's go to the next question. I have had 2 failed egg donation cycles, last one in March this year, but I haven't had a period since. Could no periods affect my chances for a third attempt? I am 42.
It's again depends of the situation of the endometrium, of the situation of the womb. I would say that if you are planning to have again a cycle, then there's one possibility that you could start using the hormonal replacement therapy to have a bleeding and to have a cycle after this situation, because the endometrium needs to keep running. I would say.
Mm-hmm. Okay. Thank you again for your question and your help with this as well. And let's have a look. Next question. On the scan, my endometrium was triple line 9.7 millimeters thickening. They stated this was good. Would I still need to take the drugs prior to the procedure?
Triple line 9%. The question is, if you are 9.7 at the moment, and if, for example, after the 5 days we're doing the transfer, then the endometrium is good. It's good, but prior, there's some differences how the doctor is preparing you before the embryo transfer. Mostly the doctors are using that you are taking the drugs and then they are doing the embryo transfer. Other situation is when they are trying to do the embryo transfer during your natural cycle. And anyway, you will have more additional ultrasound before the embryo transfer, and doctor will decide will you need to take medications, which kind, how long, how big dosages. That's doctor job.
All right. Thank you so much again for that. Next question also is right here. How long before egg donation I'm recipient should I be on contraceptive pills? Is it the longer the better? I have 3-4 months waiting.
It depends. For example, you are a PCOA patient and your cycle without the contraceptive pills are maybe one time per year, then definitely, yeah, for you to take a contraceptive pills is the wise plan. Mm. But again, your doctor could help, and he knows which situation you are and you need those tablets for how long period you need those tablets. There could be more additional reasons why you need them to take 3 or 4 months, maybe just 1 month.
Okay. Again, thank you so much for that. Next question is it necessary to do a mock cycle to due to small fibroids to test endometrial lining?
uh, Doctor needs to know that your endometrium is good, and sometimes it could help to predict the amount of medications which you need before the embryo transfer to be sure that your endometrium will be good.
And again, excellent. Thank you once more for answering this question. So, next question is so, how many donor eggs are recommended for implantation in a 46-year-old?
I would say 6 is the smallest amount of eggs, which would be good for you.
Mm-hmm. And just give me a second. Yeah, sorry, just wanted to check. So 6, you will say that the lowest number of eggs would be 6.
Yeah, it would be good. Yeah.
Mm-hmm. Okay, thank you. And next question is, so I have Hashimoto's. I stopped taking levothyroxine several months ago because it was making me feel fatigued. My blood tests show that my thyroid is still unbalanced. My question is, should I restart levothyroxine in order to help with implantation and development of baby?
In this case, I would say you need to develop a good communication with your endocrinologist, because you will need to have those medications anyway. And if you have a feeling fatigue, that means maybe there need to be changes in the dosage of the medications. And how long ago did you have done the ultrasound, and when was your last time of the test, of the blood test for the hormone levels? I would say go to your endocrinologist and say about your plans, and he could help you.
And once again, thank you so much once again for that. In regards to your answer, in regards to the vitamin D, what vitamin D do?
Oh, vitamin D is such a nice, almost could say, person. Vitamin D is helping to have a nice hair, good nails, good mood, good bone structure, and vitamin D is helping to have a good quality of all our cells and the oocytes as well. The vitamin D is very, very wise and clever vitamin, and sometimes they're talking even that's not just a vitamin, but that's hormone. And that's mean if we are living in a UK or Latvia or Scandinavia, we need definitely to have a supplement from vitamin D in our daily life. During the winter, definitely, but mostly we're working indoors. We're like an indoor animals. That's mean we're not seeing many of the sun. That's mean we need to take vitamin D.
Okay. And actually, there's a comment from another patient. So my vitamin D level 63 is too high. Planning treatment in September. Anything you could add?
No, 63 is not high. The low, it depends from the measurements, but the lowest level of vitamin D is 50, 50. That means you're good. You can use your vitamin D, maybe some drops less, but still using.
Okay. All right. Thank you for that once again. Okay. Next question is about the vitamins. Should any egg donor, take for best quality eggs? Is there anything she should not take?
Alcohol and cigarettes.
Of course. Okay.
But about the vitamins and supplements, I was telling already before, clean eating, healthy eating, eating fish, meat, salads, everything, then I guess she don't need to have supplements, just maybe vitamin D.
Excellent. Thank you for clarification. And once again, in terms of vitamins, shouldn't she not take, let's say? Anything
If she wants, she can take. If she needs she needs to take. If she, we know, but they could say that you should do something for sure for a donor. If she knows that she is not eating properly, then she needs to take the vitamins. If she knows that she is eating healthy and properly, then I would say again, why? No, I think no.
And here's the follow-up, yeah? Folic acid, iodine, etc. Prenatal.
But you are plan. I would say those vitamins need to be taken by recipient.
Okay. Understood. And I'm just checking, of course, if there's anything else. Well, it's about supplements, but for my husband's sperm. Anything you can advise?
From country to country, the medications vary for men, but there's enough good supplements for men. But before taking any supplements, it's need to be known, do he need the supplements? There's such a test as oxidative sperm test. and the test could say, do your husband need the vitamins? Maybe there is a situation then your husband uh, is doing more harm drinking vitamins instead of not drinking them.
All right, excellent. Thank you once again for that. And okay, yes, he needs vitamins. That's what well, that's what Andrea added.
Then he can choose from your pharmacies, which I can't help there because I don't know what kind of vitamins your country is having. Maybe there is much more than in our country.
Of course, but thank you so much again for that. Okay, next question is here. Do you advise genetic testing on the embryos prior to transfer or genetic testing on the fetus at 9 weeks?
Again, it depends of the situation. If you have some genetic diseases in your family tree, or if you are having age um, more than 40-45 years, if your husband family tree is having some genetic problems, or uh, there's quite of the situation when you are having by yourself some problems with the genetic actually everyone are having something in genetical field that's maybe will run through our life, or maybe will not know about it any kind of, but um, from week 11 till week 13 of the pregnancy, there is a screening program when you are having an ultrasound, and then they are taking hormones from you and binding it everything together, and those tests could say what's happening with your baby as well.
Okay, sure.
If you are having cystic fibrosis in your family, yes, definitely.
Okay, thank you for clarification. And I do see someone is typing, so I just want to see if there's a follow-up. Um, okay, we will get back to that in such case. There are 3 parts of the question, okay? So we'll show you one by one. I am 47. I had 3 failed own egg IVF and 1 donor egg IVF. All failed. Donor egg 1 miscarried after 7 weeks. Now I am not having my period. I always have my period on time. I check with the height tree clear blue. It's negative. I should have my period on the 2nd of June. I tested today. Is 10 days late, but still negative. Is this mean I got my menopause? Can't I have any baby anymore?
Uh, there is a lot of tests which needs to be done to say that you are having some problems in your hormonal levels, but it looks like there could be like that because you are 47. But if we are talking about the menopause, that then you are having no menstrual bleeding for a year, and then we are saying that you are in a menopause. Now you are premenopausal maybe, and for clarification you need to go to your doctor, and he will prescribe the tests which will say what's happening with you. If we are talking about your own eggs, then anti-Miller hormone as well.
All right, excellent. Thank you so much once again for clarification to this patient as well. Next question. So, how many embryos should be implanted in a 46-year-old?
If you are 25, 35, 38, 39, or 45, I would say one embryo, because uh, we're choosing 2 embryos in situation when there is a previous clinical problems or other conditions when we need to do that. Most of the situation in the whole world, we are trying to go to the one single embryo transfer, and it is not bad because having a twin pregnancy and having problems during the twin pregnancy is much more scarier and problematic to resolve than having one embryo, one baby in your womb. I would say anyway, if there is no such situation, then it's need to be choose two embryos. Then I would say one.
Okay, understood, of course. Thank you so much. We will be slowly finishing the 3 or 4 questions left, but if you have any questions left, of course, more, then just go ahead and type those in. And now let's have a look. My TSH is 3.7. I've read that 2 is better for TTC, but my GP says she's not aware. Still waiting to see RE. What do you suggest?
What is TTC and what is RE?
I'm not sure about RE. TTC also not really sure. So if you could clarify
Yeah,
that.
for me as well.
Yes, of course, that's fine. And let us know, okay? So we can just simply answer it for you. And yeah, I'm just waiting. Let's wait and see. TTC trying to conceive. Okay.
Okay.
Excellent. Thank you. And RE, what do you mean still waiting to see RE?
Somebody
Let's wait.
typing.
Okay.
Yeah.
So I just want to see.
It's like a Christmas.
A reproductive endocrinologist. Okay, I will show you right here, of course, as well.
Waiting to see. Definitely, the doctor will help to understand what kind of levels is better for you.
Sorry, right here.
Yeah,
Okay.
yeah. I'm saying that you need to wait the visit with your doctor, and he will decide do you need any additional medications or everything's good for you.
Okay. Of course. Thank you so much again. And also thank you for clarification. And now it's definitely more clear for us as well. And let's
Now we will know next time as well.
for sure. That's true. And now let me have a look. Next question is here. I am 43 in early ovarian failure. I have fibroids, one inside the uterus, about 6 centimeters. Does it have to be removed before egg donor?
Yes, definitely. If it's inside the endometrium level, yes, definitely.
Okay. Thank you for clarification. And then we will go back to the previous question, okay? So 2 is not a generally advised level of TSH for trying to conceive.
I don't know. Because the measurement, the numbers is differing, like nanograms in milliliters and everything else, and it's different from the laboratories, and it's quite different to say about you.
So you would need to.
I would say wait your doctor, definitely.
Yes, of course. Thank you so much again. Okay. And next question is Vitex safe? Vitex safe?
Vitex. What is Vitex? I'll try to look.
Sure. Or if you could just let us know what you mean exactly, we can.
It's sometimes better to look by myself.
Of course.
It's some supplement. Agnus castus. Yes, you can use it.
Yeah, you have checked. I see. Okay, so it's okay to use it. Thank you for clarification.
Yeah.
Thank you for checking, just to make sure.
Before the cycle, yes, yeah.
Excellent. And well, let's have a look. Next question is, I am currently considering egg donations. I have low AMH and not many follicles. Is egg donation our best option? Would DHEA help improve my egg quality?
Sometimes in a situation when your anti-Miller hormonal is low, and your antral follicle count is low, sometimes your doctor can use hormonal replacement therapy for a while, and vitamin D and zinc and selenium and fish oil or additional of sorry, again lost in my head translation, melatonin as well, like a bunch of different supplements for a while, 1 or 2 months prior your cycle. But if the AMH is low, then the donor egg program is definitely suitable for you. Or
Right.
the second option is you can do your cycle and take additionally eggs.
Okay. Thank you so much for that as well. There are like two questions left and we will be finishing. So let's have a look at the first one. When do you suggest looking into surrogacy if you have failed donor eggs attempts? Also, can the surrogate use the donor eggs? Anything you can advise on that?
In our country, don't, the surrogacy is not allowed. But for a surrogate mother, there's no difference. It's anyway that like an embryo from another person, and if you are asking about can you take the eggs from the exact surrogate mother, I'm not sure how. No, I'm not sure. I'm thinking most of the situation, the surrogate mother is just carrying your embryo. It's from donor to donor, or from your husband with the donor eggs. It's no difference.
All right, of course. Thank you so much for that. And it looks like this is our last question for today. But of course, if you have any left, you know what to do. And the question is, so given the anonymous nature of egg donation, can it cause psychological issues for the baby when they grow up?
From my opinion, it will depend from you as a parent and from your baby's psychological state as well. Because if you are talking with your kid, how you become a mother, why you choose to do that, how it happened, etc., that then I guess your baby will have no problems with that. You need to talk with your kids.
Okay. Excellent. Thank you so much for answering that, of
Well,
course. And well, it looks like this is our last question. Therefore, thank you so much for all of your questions, for joining us today. And that was definitely very interesting. Dr. Funka, thank you so much for your time, for providing all those details to us. And as you can see, there are some thank yous. Thank you so much. This was very informative. I can't thank you enough. Thanks so
you're
much.
welcome.
More of those. And there's a longer one. So thanks for the answer on TSH. And this is the additional information. Just that my appointment was supposed to be March and had been postponed to September. I'm looking to go private outside the UK, depending on flights. And I really do hope you will be able to find a suitable clinic soon. And of course, fingers crossed that all will be okay for you as well.
For everyone.
Exactly. And of course, for everyone, as you mentioned, and as you can see, there are more thank yous coming your way. What an amazing session. Thank you so much.
Welcome.
Dr. Fuka, is there anything else you would like to add?
Have a nice evening and have a nice weekend. And hopefully, everywhere is sunny and no viruses around.
Exactly. That's excellent advice. That's excellent, because we definitely want you to have a relaxing weekend. And I just want to mention that this has been recorded, so you will have a chance to watch this again. If you had any issues, then all you just need to do is subscribe to our YouTube channel. That way you will be notified when the new video is uploaded. And of course, I can only encourage you to simply register for our next events. We will be back here on Monday at 6 p.m. But sorry, I almost forgot. Today we have another interesting topic. So we will be back here at 8 p.m. UK time as well. So anyone, if you are staying home and you would like to get to know some more details on genetic screening, in fact, then I can only encourage you to join us at 8 p.m. UK time. Dr. Funka, again, thank you so much. Have a relaxing weekend
Welcome.
indeed.
Welcome.
And
Yes,
I
too.
just hope we will be able to simply do it again.
Okay.
Thank you.
Bye.
Bye.